guys, welcome back to the D&N Medical Series. It's your girl Nikki, and today we're going to talk quite a bit of stuff. Somebody sent me a photograph of an image of an actual clitoris of a female that got a clitoris piercing and her clitoris fell off. So I'm just going to tell you guys all about the clitoris piercing. The clitoris, they consider it as a pleasure center, and it's different from the vagina. It's different. So you can always Google a photograph to find out what the clitoris looks like, etc., etc. So when we talk about clitoral piercing, there is this covering, like say this is the clitoris and there's a covering of the clitoris, and we call that the clitoral hood. And this what is pierced most of the time in most clitoral piercing. You hardly ever have piercing of the gland itself, so it's basically most time the wood. All right, so why do people pierce their clitoris? So well, clitoral piercing are known to be related to increased sexual pleasures and basically increased stimulation. So what are the different types of clitoral piercing? Well, as I said before, you have the glands. When you're piercing the clitoral gland itself, this is where you pierce the actual gland and not the head or the hood that I told you guys before. You also have VCH, which is a vertical clitoral hood piercing. You have HCH, which is horizontal clitoral hood piercing. You have the triangle clitoral piercing. You have the Princess Diana piercing, and you have the Christina piercing. So what exactly are some of the risks involved in getting a clitoral piercing? So just like any other piercing, you have complications. So the first one I'll discuss is allergic reaction. So you can have an allergic reaction, whether you're allergic to the material that they use in the piercing, like nickel, or whatever they make the jewelry from. You might be allergic to that gold or whatever. You can get an allergic reaction. You can get tearing. So tearing is basically when the piercing is caught onto something and it's like it ripped out of your body. So that's tearing. That's another complication. And infection, like any other piercing, you're at more risk of getting an infection if you don't follow up proper hygiene, and if the piercer themselves don't use clean needles when they're doing the piercing, sterilized equipment, you can get an infection. There's also studies that show that people with clitoral piercings do have more sexually transmitted infection than others. Another complication is embedding. So if the jewelry is too short, your skin can grow over it and embed the piercing itself. Another one is migration and rejection. So simply put, basically, if your piercing is not staying put, it can migrate and move from its original location. And this can happen if there isn't enough tissue where it's pierced to hold it in place. So it can slowly migrate to the surface of the skin or even out of your body. Another complication is nerve damage. So although there is a potential for nerve damage with any piercing, it's more likely to occur with a clitoral gland piercing than with the hood one that I said before. So yeah, you can have damage to the nerve there, and you know the nerve is responsible for the sensation. So if you did damage the nerve there, what's the purpose of the piercing itself? And another complication I want to talk about is botch piercing. So if your piercer does not know how to pierce properly and they're untrained, and they even pierce the wrong anatomy, so they don't know the female anatomy and they're going to pierce down there and they pierce a different part, basically you can have a botch piercing, and that comes with its own complications. All right, so different piercings, as I mentioned, takes different time to heal. I'll show you a photograph of the amount of time each of the types that I told you guys about takes to heal. And guys, some symptoms to watch out for after getting our piercing is if the skin around it is inflamed or too hot to touch. There is pain when you clean it or if you touch the area. you have pelvic pain, your pain in your hip area, you have pus like discharge coming from the piercing site, there's a foul odor coming from the piercing sites, or if you just have fever, body aches, or even flu-like symptoms after getting your piercing. And if you suspect something is wrong, do not remove the jewelry. Go straight to your medical professional immediately. So guys, it's your call to make whether you think the benefits outweigh the risk. And yeah,